I find it very intriguing that you said that you had no mentors. I wanted to see if you can unpack that a little bit. What do you mean by that in
Sure,
particular?
sure. So it's interesting that every position. So we have our preceptors, right, in nursing. They're not necessarily mentors, right?
Right.
They're our preceptors, and they're showing us what we have to do. And a lot of times, how many times has a nurse been new in an environment and no one wants to precept, right? So
Yes.
you have that experience. But as you climb the ladder in nursing, and when you go into leadership, now maybe in more recent years, they're probably starting more programs to mentor
Yeah.
nurse leaders. However, as I was coming up as a nurse and when I got into nurse leadership, there was no mentorship. There was no one to really even air quote precept you, right? You were expected to come in with a certain skill set, and you had to hit the ground running. It was baptism by fire, I like to call it.
Right.
Right? So it was basically you taking what you know and learning from your mistakes. And, there were things that and for me, I increased the patient experience scores. I decreased the fall rates. I built programs. And I built programs because there was one organization where I was working and they had opened a whole new wing of the hospital, and they were implementing an intermediate care unit. The hospital never had a intermediate care unit. And because I had worked across the country in so many different areas, including intermediate care as one of my specialties, I was able to identify what that program needed. Identifying a medical director, building policies, building just what the budgets should look like. All of these things I built. Partnering with education, I built this program so that we can have the appropriate patients, so that we can bill accordingly for these patients, right? And no one really thought about the fact that no one ever said, and this was a new position, right? And I get it. I appreciate the fact that I can almost appreciate the fact that, okay, you saw what I was doing and you let me run with what I needed to run with. But there was no one who I could go to with questions. There was no one to really mentor me and guide me with the lay of the land of the hospital, of who I should talk to, or, making the transition as smooth as it could be. I didn't
Yeah.
have that. Or even when I was fighting the battles of the bias that I was dealing with as a leader, I didn't have that coach or that mentor to say, you know what, this is how this situation should be handled, or, just to give that advice and that guidance. I never had that. And I didn't have that until I got to be when I started my business and I sought mentorship as a business owner, as an entrepreneur, not necessarily as nursing. Because in nursing, I found that I was constantly reminded, unfortunately, that let's just say there were cliques, right? And and that's just what I'll use that example. I'll use that term for now. And sometimes you don't always you feel like you sometimes you don't always fit into the clique, but they
Right.
don't bother you because they know you that you know what you're doing, right? They know that you know
Yes.
your stuff, and they know that you're an expert, but you're also not that person. They try to make it appear it was made to appear that you're so strong, you're so good, you're this. However, you know you still, no matter how strong you are, no matter what level you go to, you still need that coaching and that mentor. Oprah still has a coach, right? Like Oprah, like Oprah Winfrey.
Yes.
You need a coach at every level, and a lot of organizations don't offer that. And I can remember when I was in my doctoral program, one of the nurses, that was actually her a quality improvement project. It was to implement a mentorship program for nurse leaders because it isn't. They just don't have it. It isn't around.
Yeah. Yeah. They definitely are doing. Before I left, they were definitely doing a lot more around that. But